Thanks, Taylor. So as Taylor noted, I'm going to go ahead and just read through a joint statement prepared by Nebraska Medicine and the University of Nebraska Medical Center. We are entering a dangerous period for our state in the course of the COVID-19 pandemic. Cases and hospitalizations we have seen is currently upon us in Nebraska. We know how to beat this virus, but we've gotten complacent. COVID-19 has now killed nearly 500 Nebraskans, and many more are likely to die if we don't take more immediate action. Nebraskans have a long history of helping our neighbors to work through the most difficult tragedies, like floods, ice storms, tornadoes, and droughts. We need to find that spirit of community now more than ever to overcome coronavirus in Nebraska. Myself and this group of clinicians cannot emphasize enough that COVID-19 is not a political or ideological issue. Our advice is the same regardless of political leadership at any level. Our advice remains to wear a face covering in public, to avoid large gatherings and close contacts indoors, to maintain at least 6-foot distance from others in public, to practice good hand hygiene, hand washing, to stay at home and call your doctor if you are ill, to quarantine at home if you have been exposed to someone with COVID-19, and last and perhaps most important right now, to cooperate with public health in tracking illness and exposure throughout all of our communities in Nebraska. Our daily counts of COVID-19 cases and hospitalizations are now equal to our May peak and rapidly rising. In fact, we've reached record levels. However, we continue to relax social distancing measures in place to fully open schools, all while cooler weather begins to drive activities indoors and the annual flu season looms. To absorb the increasing load of patients, Nebraska is relying on hospitals that are currently more than 85% full. This is a very different scenario than what we saw in April and May when hospitals were 50% full. This is potentially a perfect storm for Nebraska. Early in the pandemic, Nebraska took sensible and strong actions to mitigate COVID-19 spread, and we reaped the results of those actions by having one of the lowest fatality rates of any state in the United States. We built a solid structure of community protection, much like the game of Jenga, but we have steadily removed one block after one block of that tower, lifting limitations on occupancy inside of restaurants, opening bars, allowing large gatherings, and opening schools in some cases at full density. As the structure of protection weakens, our case counts are accelerating. Now some communities are considering further rolling back measures, including the rollback of the use of face masks. Removing that block and the entire system may collapse. We understand that everyone across the country and in Nebraska has pandemic fatigue, and I assure you that everyone up here today has pandemic fatigue as well, as do our other clinical colleagues and our public health colleagues that have been working tirelessly since March, April, May. But we are hearing too many COVID patient stories that start with, "I was at a party," or "I visited extended family, and everyone seemed well at the time." You've seen it on Facebook feeds, a dozen of friends eating dinner in small indoor spaces with no masks in sights, 300-person weddings over the weekend in central Nebraska. These are the perfect environments for COVID-19 to continue to spread in Nebraska, which threatens the lives of our most vulnerable neighbors and family members. We cannot let down our guard. Finally, the COVID-19 response is not an all-or-nothing proposition. Many states and countries have shown it is possible to suppress spread without going into complete lockdowns. We can strike an effective balance. Now is clearly not the time to relax restrictions in Nebraska, but by following precautions mentioned above, we can weather the storm this fall and winter while supporting our economy and our overall community well-being. Together, we can emerge in the spring to a vaccine and a clearer road back to normal. So that concludes the prepared statement from the university and the hospital. Myself and my colleagues are happy to take questions.
So how then do you relay this message to the local leaders and then, of course, the governor, who basically, is saying, hey, it's okay to relax, restrictions when you see the cases, going up?
Yeah, so I think that what we want to continue to stress is that we absolutely know how to control transmission in our community. The steps are very straightforward. We're just concerned at the level of not following those basic rules of wearing a mask, avoiding large gatherings, avoiding indoor congregate settings. And we want to make clear statements on what the science and the data supports. Any comments to add? I'll let Dr. Lawler speak to that. He's been following the community data.
Thanks. I think that the phases of pandemic response were especially helpful early on in trying to create context and frame conditions for appropriate response. I think now we've learned enough about how the epidemic behaves in communities to understand what measures are most appropriate. And certainly we have not yet reached levels of community transmission where we can open businesses up fully, open schools up fully, and return to what people would consider normal community activities. So I think ultimately what we should base our decisions on is not necessarily those constructs of which phase we're on, which were made really earlier before we knew as much about the pandemic as we do now. And we should really base those decisions on what are current conditions, what are case counts in the community, what's happening with our percent positive testing, what's happening with hospitalizations. And I think we have a pretty good feeling of where we are with that now. As Dr. Lowe pointed out, we're at record numbers and we're going up. So we know that we need to do more in terms of restricting those opportunities that allow the virus to spread.
City Council is voting on the mask ordinance tomorrow. There seems to be some council members really on the fence about whether they're wanting to continue that or not. Are you saying we should continue this mask ordinance?
Dr. Rupp, do you want to make some comments? Dr. Rupp has been a part of those hearings.
Thank you for the question, and I do not think that this is the time to rescind the mask mandate for the city of Omaha. This is the time actually to expand that mandate throughout the state.
There was a medication that the president was on while he was being hospitalized. I'll probably say it wrong. Is this a medication that we're seeing used here in our hospitals?
We are participating in trials or using all of those medicines that the president received, but we're doing them in a responsible way in which patients who meet indications are receiving the appropriate medications, or we're giving them in a study situation to fully elucidate how helpful they are and in which patient populations they should be used for.
What is average hospitalization time right now for a COVID patient here in Nebraska?
It's quite variable, and what we do know is that in the severest ill patients, they can stay in the hospital for weeks at a time. Perhaps I'd ask Dr. Johnson to address that a little bit more fully, in that he's a critical care physician who is taking care of these patients in our ICU.
As Dr. Rupp said, our hospitalization length varies a lot. We've had a few people that come in that are well at baseline. They're sick enough to be in the hospital. They're here for a few days or several days. When they get to the ICU, which is where I work, our median length of stay is 22 days for the people that make it to the ICU, and that's people on ventilators and not. For the patients that go on to a ventilator, our typical course is about 3 to 5 weeks on the ventilator, and it's nationwide, it's 50% mortality rate if you end up on a ventilator with COVID-19. So that has been pretty consistent throughout the pandemic. We may be seeing a little bit of an improvement with some of the therapeutics that we now have, but that's going to take time to really see whether that's signal or noise. We're hopeful that it is helping, but as Dr. Rupp said, really big variability. This virus seems to affect different people in extremely different ways, and it's not always the people you predict that don't do well. We have had people in their 40s die in the ICU here. We've had people in their 30s on ventilators for 5 weeks. So the myth that this only affects elderly people or really frail people is exactly that. It's a myth.
As we get into the flu season and we're still in the pandemic, are you all worried about your capacity as we head to
Yeah, the ICU beds in the Omaha metro area right now are 85% full. So as we head into a normal flu season, 85% occupancy of ICU beds makes people like me uneasy, because we know we're going to have an increase in patients coming into the ICU and needing ventilators. We do every year. So the thought of having a flu season and a COVID-19 pandemic on top of it at the same time makes us extremely uneasy. I mean, we were far beyond ICU capacity in May. We opened up multiple units, 3 additional units that were dedicated to COVID, and we were completely packed. And we started that at 50% capacity. We're going into this at 85% capacity. And that's part of the reason why we made this statement, and part of the reason why we wanted to kind of get the word out to Omaha and to the rest of the state, that we have, individual people, we all have the power to slow this down. But if people do not change the way we are currently behaving, we are not going to have capacity. And the assumption that you can get, if you get sick, that we're going to have a hospital bed for you is a false assumption. We can fill. Lincoln can fill. Omaha can fill, Grand Island can fill, all of our hospitals can fill up. And then you could be sick with COVID-19 outside of an emergency department, and we may not have capacity. That's really the main message, at least from my perspective.
We saw you guys build some of those temporary kind of dome sets earlier on in the year. Obviously, are those something that we can do in harsh Nebraska winters? Are you going to look at other expanded facilities that can fill up our beds?
That's probably not my best area. I don't know if Dr. Rupp, do you want to address that? Or?
So early in the course of the pandemic, we drew up extensive contingency plans that would include having emergency shelters as we have erected outside the emergency department. We do have those plans in place to how we would potentially expand. We did demonstrate that we can create capacity within the system by completely curtailing elective surgeries, by decreasing the number of patients that come into our ambulatory clinics. We very much hope that we don't have to resort to those sorts of activities again, because they obviously come with some degree of harm.
Based on the restrictions for each phase, what specific phase would you recommend that we go back into?
So I think that as Dr. Lawler pointed out, there are ways in which we can prevent the transmission of this virus from person to person without going into a strict lockdown and throwing our economy back into the ditch. So we clearly all need to do the things that we're talking about, and that is to avoid close confined settings, to wear a face mask, to keep our distancing from one another, to wash our hands. These are the things that we know will prevent the spread of this. That doesn't necessarily mean that we all have to stay at home and shelter. We just need to be careful, and we need to be cognizant of these things and do the right thing for each other. And we'll get through this, and we'll get to a good place.
How do you get the message out to people that have heard the same thing over and over and over again and still don't believe it?
That is difficult, and unfortunately there is misinformation that is being circulated that somehow this pandemic is a hoax, that it's not real, that it's being manipulated for political purposes, and unfortunately nothing could be further from the truth. This is a real disease. It really does cause massive suffering and deaths. Well over 200,000 Americans have lost their lives from this. Compare that to an average death per year for influenza of about 25,000. It's quite evident that this is very impactful, and we need to be taking it seriously. The data speaks for itself. The number of cases rising, the number of hospitalizations rising. Nothing could be more plain.
One thing that I've heard said before, you're more risk if you're in a building with somebody like for 15 minutes. Is it a situation where the virus builds up, or why 15 minutes as opposed to just
So we're learning more and more about how this virus behaves and how it's transmitted. And some of the variables remain undefined, so we're not sure of the infectious dose that's involved with creating infection in people. But what we do know is that the closer you are to somebody for a longer period of time, your likelihood of becoming infected rises. So this is clearly going to be more prevalent, more likely in a confined indoor airspace, hence why we feel safe to bring people into this outdoor space with all of this wind sweeping through. This is a very safe environment for us. If we were indoors, all sharing the same air with an air handler that did not turn over the air or filter it, we would be in danger. So this is the reason why we're stressing that, outdoor activities are safer than indoor. Even in an outdoor activity, however, as was clearly demonstrated here in the recent past with the Rose Garden episode at the White House, that people outdoors who are not wearing masks, who are close to one another, can contract this virus. Well, clearly we have individualized to some extent throughout the state because the rate of transmission is not necessarily the same in every community in the state. And I think that does need to continue to be taken into account. But the data also shows that throughout the state that we're seeing COVID-19 penetrate into rural communities. And I think all communities need to be very cognizant of this and to take appropriate precautions. All of us as individuals can certainly take the precautions of wearing a mask, keeping our distance, washing our hands, and doing the things that we know will prevent the transmission of this virus from one person to another.
Some people might say that the mask mandate is ineffective because of what we're seeing. Dr. Buell, can you address why that may not necessarily be the case?
Yeah, so I was asked to talk about the mask mandate and the influence of the mask mandate on our case counts. And, we do know that masks work. We have, I would say, enjoyed the use of masks here in Omaha in businesses. I know the Chamber of Commerce particularly, said that it's good for businesses to have a mask mandate here in town because it makes people feel safe utilizing these businesses and frequenting these businesses. The issue is that the masks don't, they don't solve the problem of people getting together in large groups, particularly large family groups, friends, that sort of thing, where masks aren't worn. And so it may not be now where people are getting, contracting COVID from going to the grocery store amongst a bunch of people that are unmasked. Instead, what we're seeing is this transition into sort of a lackadaisical, phase where people really are not heeding those precautions when they're getting together with their families or with their extended friend groups and that sort of thing. And so, the common stories that we do here in the unit are those of getting together with larger groups of people. I can tell you, I review the vast majority of patients that come into our units, and those are very common sentiments. Things like, I got together with a group of people, everybody seemed very well. We tried to be outdoors, but we really weren't social distancing. There were a lot of hugs, there were a lot of, close contact, or we were indoors for a prolonged period of time, but I was with a relatively small group of people who all seemed well. Those are by far the most common stories we hear in the unit. They're also, as evidence of increasing community transmission, a lot of stories that start with, I have no idea how I got this virus. And that's the scary part. And that's where we just, when you're out in the community, there's a chance, when you're around other people that you could contract this. And as Dr. Johnson relayed, the problem is that there are lots of people that get very sick. There are lots of people that don't get sick hardly at all, but you don't know what group you're going to be in. And that's the scary part. And that's the thing that really, when I hear patient stories and deal with our patients in the unit, that's the part that's the most disturbing, is just the number of individuals that get sick, and often people who do not have any idea where they contracted the illness.
Dr. Broadhurst, can you address where we are with how we're still doing testing here, other types of tests that might be useful to over here in the fall and
Yeah, so our testing capabilities continue to rely on our centralized laboratory facilities that are here and servicing the state through Test Nebraska. There are a variety of new technologies that have begun to reach patients and communities in Nebraska and nationwide that are creating new opportunities to obtain testing in both outpatient settings as well as even home-based collection settings. So these improvements in technology and the increase in availability of authorized tests that can be obtained in alternate settings will certainly help us to expand our access to testing statewide.
So good question. The question was, as weather gets colder and people are obviously going to spend more time, how can they still manage to safely get together? And I think that the principles we discussed today and common sense are the most important things to keep in mind. You want to limit close contact. You want to limit confined spaces. You want to limit large gatherings and crowds. And you want always to wear a face covering. In a sense, that's the 4 C's, right? So a face covering, close contact, confined spaces, and crowds. If you can eliminate those things, you can dramatically reduce your risk for contracting COVID-19 personally, and you can also limit the risk for causing large outbreaks or clusters, which we know now are one of the more important phenomena in driving transmission in communities. And so the idea of limiting those large gatherings and crowds indoors in concentrated settings is going to be increasingly important as the weather gets cold. That's one of the reasons why we're concerned about relaxing some of the provisions around restaurants and bars and other gatherings, and frankly, why we are concerned about schools going back to full density. Certainly, there are some schools that can manage to have full capacity and still maintain 6-foot distance or more between school children. But obviously, there are many schools in higher density urban areas that simply cannot. And we're concerned that bringing all of those kids back in full density will only serve to accelerate what we're already seeing in increased case counts across Nebraska.
Are we seeing any cases of false negatives in the community where someone gets tested and it comes back negative and then later on it turns out, that they might have had it and just tested negative? I know that's kind of an issue on the national scale right now with everything going on with the White House.
Right. Well, I think a couple of important things that people should keep in mind about testing. First of all, timing makes a big difference. So I think there's a misperception that if you're exposed to even a confirmed case, and then you go and get a COVID test, whether it's a day later or 2 days later or 4 days later, if that test is negative, then you're in the clear, and that's not the case. These diseases, all infectious diseases essentially have what's called an incubation period, a period of time between when you're infected and when you actually become ill, and we can detect infection. And that incubation period in COVID, we know, can be up to 14 days. And so that idea of 14 days of quarantine is still very important. Even if you get tested a few days after exposure, it does not mean that you will not later on go on to develop symptoms. So I think that is one of the sources of misinformation, that people think, well, it was a false negative. It actually was not a false negative. It was true. You do not have manifestations of disease right now. You're just still in the incubation period. The second issue is with some of the new tests that Dr. Broadhurst brought up. we do worry about the sensitivity of those tests. They are not as sensitive as the laboratory-based PCR tests that we do here in our hospital, which are the most sensitive. And so we need to keep that in mind. Those tests have been used particularly in some circumstances in screening nursing home patients, and in other situations those antigen tests in particular are the ones that are most broadly available and lack the sensitivity of PCR tests. So they need to be used very carefully in the correct context and by professionals who understand how to interpret the results.